Hi class, this is Professor Melissa Wilgruber, and I will be going over a video on how to use hypothermia protocol via the Arctic Sun Machine 5000 and also reviewing how to use the Arctic Gel pads. First, you would be made aware that your patient would be coming and receiving therapeutic hypothermia protocol. You would want to know as much information as possible about the patient, including the height and weight, in order to get your proper pads. And then you would go and retrieve all your items. So first you would get your Arctic Sun machine, which is the Arctic Sun 5000. You would wheel it in your room, plug in the machine. The plug can be found at the back of the machine. Plug it into an outlet. Next you would want to retrieve your Arctic Gel pads. They come in silver packaging. So you would want to get one kit, which includes 2 chest pads and 2 thigh pads. If you know your patient's height and weight, then you can get the appropriate pads. If not, I would just grab a large to begin with and a universal pad. And then when your patient comes, you can exchange them for a better size if they're not the appropriate size. And there is a sizing chart that you can refer to. It has women's size, and again, they come in 5 different sizes: extra, extra small, 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 medium, and large. And on each Arctic Sun, there should be a conversion table so that you can also refer to that. With the different sizes. Next, once you know information about your patient, you would want to refer to your eligibility checklist that I included in Module 1 and just confirm that your patient does meet criteria for the hypothermia protocol. In order to be most prepared for when your patient arrives, you want to have all of your equipment. So you want to get the machine, the pads, the temperature probe, which you will be using according to your hospital protocol. At my hospital, we use it rectally. And then next you want to start with powering on the machine and getting your equipment set up. So after it's plugged in, you want to come to the back of the machine and power it on with the power button that's located right here. The machine takes a few seconds to a minute to boot up. So while that's happening, you just want to wait for the screen to turn on. So that you can initiate your therapy. I would not open the pads until the patient arrives. They're very expensive and you want to make sure that they're the right size. And this is all touch screen, so when it turns on, you want to just start your therapy, and we'll go over how to do that. So this screen says patient therapy selection, and if it's a new patient, you want to go with the new patient, and you can either select from normothermia, which is set at 37 degrees Celsius, or hypothermia, which is set to reach the goal temperature of 33 degrees Celsius within 24 hours. It should be reached within 6 hours of initiation of cooling. If you just stopped therapy and went for a transport with your patient, when you come back, you will see this screen and you could continue with your current patient. So for right now, we're going to select hypothermia. And it asks, do you want to confirm new patient treatment selected, and we are going to confirm and hit continue. And then this is the screen. Right now, your patient's temperature is 37.0, and we're going to do pool patient, so you can hit start. But first before we start the therapy, we want to check to make sure the water level is okay, and I'll go over how to fill the machine with water. Initially, it takes about 4 liters of sterile water by using the water reservoir, which is located in the back of the machine. And you have to use sterile or distilled water. You remove the tube where it says remove to fill. You would open your sterile water and insert this in the bottle. And then press to fill. And when you're finished, you put it back in the machine and the water should be filled. The way to do that on the machine is hit fill reservoir. And it tells you exactly what to do, like I just showed you. Insert fill tube into bottle of sterile or distilled water. Do not use tap water, and press start to begin cycle, and it will start automatically sucking up the water into the machine. And then we will go over how to connect the temperature probe. So when your patient comes, you want to attach the pads to the patient and also insert the temperature probe according to hospital protocol. This is what a temperature probe looks like that attaches to Arctic Sun 5000. And it attaches like that, and then you insert it according to hospital protocol. Rectally is what we use here. Go over how to attach the pads. So you will have one kit, open them, and you'll take out 2 test pads, apply them to your patient by peeling back the adhesive, white adhesive paper on them. And it shows you on the pad how to apply them. So a chest pad on the front, you would roll your patient to the back, and then you would do the same thing on the opposite side with the same pad. And then this is a thigh pad, so you would have 2 chest pads and 2 thigh pads. The thigh pad, the smaller, thinner part goes on the front of the thigh. You roll the patient and then you wrap it around, and it can overlap. And that is a thigh pad, and another one will go on the opposite leg. And then connecting these to the Arctic Sun machine, it's very simple. You get the end of the cord, the plastic clips, and they go blue to blue and white to white. So this is what's attached to the machine, and this is on the patient. Blue and white. So blue to blue and white to white. And you pinch, push, and pull, and then they lock in place. And you just want to pull to make sure that it's locked. To disconnect, you pinch, push, pull. And it clicks to ensure that it's locked. You may have extra slots open because you can use universal pads if the patient is larger and the large pads do not fit. So there may be open spots if the patient's a little smaller and you only use one kit of pads. And we'll connect the thigh pad also. And you just want to confirm that it's connected securely. And then we will, once the pads are connected, the water reservoir is filled, we would start the therapy. It said therapy stopped because the pads were not connected. And you just want to confirm that the target temperature is what is according to your hospital protocol, and the duration of time is also accurate. It should be obtained within 6 hours of starting the therapy from initiation, if that started in the emergency department, it should be reached within 6 hours of that time. To start the therapy, you want to hit start where it says cool patient after confirming that all the information is correct. If you need to adjust anything, hit adjust. This is saying cool patient for 24 hours before rewarming begins, which is accurate. You want to be induction phase happens within 6 hours, and then the patient stays in the maintenance phase for 24 hours.
Exercise, exercise, exercise. Cold triage. Cold triage, cold triage.
And this is saying problem treatment is currently programmed in the rewarming phase, but the start button's cool, so we will hit stop because we are not rewarming.
Therapy stopped.
And we are going to hit start for cooling.
Therapy started.
And on the screen it has a graph. It will have what your patient's temperature is going across in the yellow dotted line. And then it will also tell you the water temperature, the water level. So the water level is full, the 4 bars. If it was low, it would be 1 bar, 2 bar, and it would tell you you need to add more water. And then if you have to go with a patient for a test during the therapy, that is absolutely able to be done. You can hit stop therapy.
Therapy stopped.
And confirm stop. So
Exercise,
press start to
exercise,
empty water from
exercise.
pads.
Cold triage, cold triage, cold triage is in effect.
We would hit start to empty the water from the pads. Emptying pads process will end automatically when pads are empty. If you want to stop to interrupt the cycle, you would hit stop. But this is purging the water from the pads back into the machine, so when you disconnect the pads from the machine, no water leaks out, and you can leave the pads on your patient and travel to the test. We're going to just hit stop right now and restart our therapy. When you return from your test, you would just reconnect the
Therapy
pads.
started.
If you turn off your machine, you can select current patient from the first screen when you turn it back on, and then restart the therapy where you left it off. And then rewarming would be the last phase of the hypothermia protocol. And when your patient has reached the target temperature and stays in the maintenance phase for at least 24 hours or according to hospital protocol, you want to start rewarming at a slow rate. You would press stop to change modes.
Therapy stopped.
And then you want to confirm what the target rewarming temperature is and the duration. And if you want to hit adjust just to see your settings and check at the rate of rewarming, you want to slowly rewarm your patients. During the rewarming phase, there are a lot of complications that can occur, so slow rewarming is what is recommended. And my hospital protocol is to rewarm at a rate of 0.25 degrees Celsius per hour over 16 hours. Just confirm against your hospital protocol. And then hit start.
Therapy started.
And I usually would recommend having a second nurse with you just to confirm everything if you're not familiar with this, or just want someone's second set of eyeballs to make sure that everything is correct against your hospital protocol. And that is the brief overview of the Arctic Sun 5000 and the Arctic Gel pads. And then we'll stop therapy. If your patient's finished therapy, we'll stop.
Therapy stopped.
And we'll go over how to turn off the machine. Same way you turn it on. Come to the back of the machine and press the power button off. And the pads are good for up to 5 days. So you can leave the pads on the patient if they need to go back on and they spike a fever and they need to just be cooled down a little bit. I would save the pads and leave them on, but you want to go over the skin assessment with them. You want to peel back the pads on your patient every 4 hours to inspect skin while they are on. If they stay on for 5 days or 1 day, you need to assess your skin prior to putting them on to make sure there are no skin abnormalities, and you document if there are any before the pads are placed, and then during therapy and while the pads are on the patient. You need to peel back the pads fully and assess skin for any skin breakdown or skin abnormalities. The main thing that we do see with them occasionally will be like a line from where the pad ends that sometimes causes a suspected deep tissue injury. So you need to assess skin and document if any abnormalities are present or not. And I can go over, this is just a little piece of a pad so you can see it a little more clear. The white adhesive and then the hydrogel on the pad with little bumps. The water fills in here and stays contained inside the pad, so there's no leakage. If there ever was leakage, you need to check your pads for a puncture hole and replace that pad immediately. And this hydrogel helps protect the skin. It's not really abrasive to the skin, so there shouldn't be skin issues, but you still need to assess your patient's skin every 4 hours and document. And I think that's everything on hypothermia protocol via the Arctic Sun machine and Arctic Gel pads. Thank you.